Hello, everyone, and welcome to another episode of HealthCast. I'm GovCIO MNR staff writer Sylvia Oakland, and today I'm joined by IHS CISO Ben Koshy. Thank you so much for joining us on the show.
Thank you for having me.
So, you've said something consistently that really allows people to understand how cybersecurity connects things that they may not usually think about. And that is cybersecurity is patient security. And I think that really resonates with me for a lot of reasons. So, with that thread, what types of education or resources are you using to drive that message home?
Sure. So internally, we come up with a lot of cybersecurity awareness products. I think all government agencies and employees, even contractors, know they got to take a yearly training about it. So we really emphasize the fact that cybersecurity is not only patient safety, but patient security also. We also indicate that things that they didn't think about before are part of that IT landscape. I think every home now has got a smart speaker or an Alexa or a Siri device that's listening and things like that. And it's a great convenience, but again, it's IT. You need to have the security behind it. So we try to do a lot of educational campaigns with our staff. When people started to work from home during the pandemic, we reminded them not to have your Alexa in the same room that you're working with. We don't want them recording your conversations with patients and things like that. And just developing that awareness was kind of the priority of people understanding IT is around them all the time.
Yeah, it's becoming increasingly integrated into our lives. And in the room that we're in right now, the control panel has a lock on it. And we were joking, what if you had to use MFA to unlock it and to try and change the temperature of this room?
Absolutely. From a security standpoint, I would love that, but I'm sure from a usability standpoint, everyone would be like cursing, why did the security guy have to lock the HVAC units?
Exactly. And that's again, a lot of this comes down to awareness. And I think about some of the customers that you serve, the people that you serve, the citizens that you serve, and a lot of them are in remote access areas. So how are you securing those connections? Do you mind kind of walking through soup to nuts what that looks like?
Sure. So a lot of the technologies we're adopting have to be specifically geared for those type of connections where there's high latency, low signal strength, things like that. And some of them are still using very slow internet connections. I know in metropolitan areas we're used to having fiber and gig connections, things like that. But some of these areas are still running at only 50 or 60 megabits per second and a lot slower. So whatever technologies we put in place have to be able to still work. So that may include using special access browsers where they log into the website and it just tolerates if there's a drop connection. Most places will say, oh, connection's dropped, you got to reset it. We'll set up a little bit more tolerance where there's a drop connection. Maybe there's some stuff you can do offline on that system first. And then as soon as the connection's reestablished, it'll just upload what you did and try to keep you in sync. And then ensuring that the security is still there no matter what. Just because there's a slow connection does not negate the need for security. So ensuring that that same level of security, even if it's a slow connection or a super fast connection, gives you still that high level of assurance that it's a secure connection.
Yeah, I think that's all extremely important when you're thinking about the telehealth and how it is becoming an increased way to access. I mean, I never thought that I would be seeing my dentist for a preliminary check in my bedroom, but I've done it during COVID, and that was a unique experience that I can imagine for people who have slower internet bandwidth can be a rocky experience.
Yeah, and absolutely. And it's not just a bandwidth issue, it's an availability issue. Sometimes, especially for specialists, we just don't have enough specialists across the country that everyone can see when they need to. So having that telehealth ability is a really important thing. If there's a psychologist they need to talk to, enabling that connection, or dermatology or other specialties that are just really well suited for that telehealth capability. Ensuring that the technology is there to provide a good patient experience and a clinician experience is important, but also that the security is there. I mean, it's still a HIPAA-protected conversation, making sure it's properly encrypted and things like that, and also making sure that security is kind of transparent to the patient. So when a patient is logging into something to talk to their doctor, their first thought isn't, oh, is this a secure connection? I mean, as a security person, that's my first thought anytime I log in anything. But for the normal patient who, they shouldn't have to worry about it. They should just assume, this is a healthcare system, government run, the security is on their mind. I don't have to worry about my patient data being affected. I can log into this and not worry.
Yeah, 100%. And I wanted to pull on something, and maybe in a slightly different way, but when we think about, again, that user experience, I think about how clinicians are using AI and how they're using it often as a scribe, but there's been some conversation about how, we can use AI in the healthcare setting. And so where are you at IHS looking for AI and or automation for cybersecurity specifically?
So we're looking at the AI aspect to automate a lot of processes and make them a little bit more efficient, so that our analysts can focus on what they need to do, the things that need human eyes on. I know people get a little bit scared if you put AI into cybersecurity, or cybersecurity analysts going to lose their job. No, to me, it's just another tool. I mean, historically, we've been an understaffed agency. I'm not losing anyone to anything. I'm going to keep them here. We just got to teach them how to use that AI aspect to make sure that they can use it properly. I value an analyst who's familiar with AI, who knows what it can and can't do and knows how to use it in their workflow. So if there's 10,000 alerts that they have to look at, well, the AI there will just look at all of them and rank them for them, and then these are the automated processes it can do. But when it gets to that decision point, ensuring that the analyst has the information they need, because we don't want the AI making decisions for us. We want it to enable us to make the proper decision.
Of course. Ben, this has been such a great conversation. I really appreciate you joining us on the show and for being here live at our CyberScape, the Federal Cybersecurity Summit. Thank you all for listening.
Thank you.